Hi everyone. In this video, I'm going to be showing you how to use an Ambu bag or BVM. These are very important because in the case that you do need one, it can save a baby's life. So they're typically used after a delivery if a baby has failed to take their first breath and initiate breathing on their own. And then it's also used in the NBU if a baby has stopped breathing. So it helps ventilate the baby and give them breaths. So we'll walk through the pieces of an Ambu bag. To start, you have the mask. This comes in different sizes. There's preemie, neonatal, and infant size masks. So you always want to make sure that it's the correct size. It covers their nose and their mouth, and it's not too big or small. You have the PEEP valve. So that's generally kept open to help control the amount of pressure that you're giving to the baby when you're ventilating them. You don't want to give them too much pressure because that can be bad too, can pop their lung. This area is where you actually give the breaths to the baby. You never want to completely deflate this part of the bag. It's just gentle with babies. And then you have the reservoir bag, which will inflate when you turn on the oxygen concentrator. You have the tubing, and then the oxygen concentrator itself. So before you come on shift or before you start your shift, and then also before delivery, you always want to make sure that your equipment is working and it's functional. So the way that you do that is you first turn on the oxygen concentrator, make sure that is plugged in and working. And then what you'll do is you'll place the mask on the palm of your hand, do a firm grip here, make sure that this reservoir bag is inflating, there's not any holes in the bag, and then you'll give practice breaths. You should feel some resistance on your hand here, and this is just to make sure that the bag is working. Okay, so our Ambu bag is working. We can now put it on the baby. Whenever you're putting it on the baby, we use a CE grip. So the C goes on the mask, and then the E helps lift their chin up. So the mask goes on the baby, the C is on the mask, and then the E helps lift the chin up. And then we can begin ventilating the baby. There's a rhythm that you do whenever you're providing ventilation, and it's breathe 2, 3, breathe 2, 3, breathe 2, 3, breathe 2, 3. You want to look for the chest rise, equal air entry if you have a stethoscope to listen, and then you can also see if the heart rate is starting to increase. So again, this is the most important piece of equipment to know how to use as a student because it's life-saving, and you always want to make sure that this is working before a delivery or whenever you come on shift because you never know if you might need it. So I hope this video is helpful, and I'll see you in another one.